myself. I'm a therapist. Wash my hands. Okay? All right, Cindy, what we're going to do today is we're going to take a look at how you're moving your neck and your trunk, your back, because I understand you're having some problems with that. I'm going to take some measurements, and then we're going to come up with a plan so that we can figure out how we can help you with therapy. Okay? So what do I do next? Explain a little bit about what I'm going to do. Okay? I'm going to need to touch you for some of these procedures. Is that also okay? At some point, make sure before you tell the person that you're going to touch them that you ask permission to touch them. Okay? So, yes. Oh, no questions. Okay. All right, so I've just introduced myself, what we're doing. I have washed my hands. I've asked permission to touch her. Okay? Now, Cindy, the first thing I'd like to do is just see how you're moving before I even begin touching you. So I'm going to ask you to do a couple of movements with me. You can just watch me and do it and then do it yourself, okay? So first thing we're going to do is look at your neck. So what I'd like you to do is bring your chin down towards your chest and then up towards your ceiling. Okay, good. Can you bring it down to the chest again because I didn't get to see that. Great, and then up towards the ceiling. Good. Any problems with that? Okay. The next one I'm going to ask you to do is to turn it over to one side and then over to the other. Okay. Any problem with that? Good. And then I want you to bring your right ear to your right shoulder. Just wait until I'm done if you wouldn't mind. Okay, right ear to right shoulder, and then nice and slowly left ear to left shoulder. Okay? Good. And great. Any problem with that? Okay. That's the screening for the neck. Okay? And this is how you're going to remember it. Yes. No. I don't know. Okay? That's the screening for the neck. So you always screen the motion before you're going to measure it. Okay? Now, although we're not going to go into trunk measurements right now, I want you to see me screen the trunk. Okay? So Cindy, I'd also like to take a quick look at how you're able to move your back. Okay? So can you stand up for me? Great, excellent. I just want you to lean over towards the side. Great. And then come on back up and over towards the other side. Great. And then you can just lightly give yourself a little hug and rotate around. Good. And around to the other side. Any problem with those? Okay. And then can you come forward down towards your toes? You can't do. You're so flexible. Fabulous. Good. Stand up. Okay. And then can you come back as far back as you can go? Great. Excellent. Good. Thank you. Have a seat for me. Okay? So that's a screening for the trunk. All you're doing is doing the motions that you're going to be measuring anyway. Flexion, extension, rotation, and lateral flexion. Okay? So we've screened all her motions. Next thing we're going to do is palpate. We need to be able to find those structures that we're going to use in order to do our measurements, correct? So I'm going to focus a little bit on the structures you need to know around the neck. And again, we'll talk you through these in a couple of minutes, so do not panic. All right, but I'll just show you what I'm going to do. And then he's going to talk us through a couple of the ones on the trunk. Yes? No? Yes? Yes. Okay, good. All right, so the first thing, so I've asked for permission if I can touch. So, Cindy, I'm just going to feel a little bit. You let me know if anything I'm doing hurts you, okay? Okay, it's not supposed to. So the first thing I want to do is find the mastoid process, which is that little projection behind your external ear. Find your own mastoid process. Okay, so I'm just going to come right behind your ear and find your mastoid process. That's one of the axes for cervical flexion and extension. Great, I found that one. That's super. Okay, good. All right, then I want to find about where C1, C2 is. So that's coming right off the occiput. So you're going to feel that nice bulge on the back of your skull. Okay, come right down and see that little indentation. That's about where C1, C2 is. Okay, so that's going to be the axis for lateral flexion. Okay, so you feel that right up there, big bulge in your head, and then right underneath it, that little indentation. That's about where your axis is going to be for lateral flexion. Yeah, right here. See the big occiput bump, and then come right down underneath it. Okay? Yeah, you got those two ligaments on either side. Okay? Ligaments nuchae. Okay? And then it's right underneath there. That area feels really good if someone massages it, like we're doing right now for her. Right there. All right, that's her C1, C2 area. Okay? All right, and then the next thing that we want to do is I want to find where her, let's see, let's find C7. Okay? So C7 is going to be the most, it's called vertebra prominence. Remember we learned about that one? So we're going to go right down her cervical vertebrae, and you're going to find the big bump that you feel, okay? And I have a hard time because I find a couple of big bumps. So what you know with C7 is it moves. The thoracic vertebrae really does not move. It stays pretty stable. So once you get down to the first big available bump, just to make sure you're on C7 versus T1, I want you to ask your your patient or your client to bend and straighten their head. Can you do the yes movement for me? And it should come right into your hand. Good. Come on back. Good. And back down again for me. Okay. And if you're over C7, it's going to go right into your hand. You're going to feel that vertebrae move. Okay. So I'm right on her C7, and you can feel it on yourself. Okay. If you're too far down, the thoracic vertebrae won't move.
You said it's the first big bump.
Right. First big bump, and it should move, Aisha, when you're doing this movement.
You can feel it even when you don't get your head down.
That's right. That's right. But just because right after that comes your thoracic vertebrae, and they're pretty big.